Pregnancy is classified into low risk pregnancy or a high risk pregnancy. There is no risk pregnancy. It means essentially every pregnancy has an element of risk. Some of these risk factors are already known. Some of the risk factors happen for the first time during pregnancy. When we say there is a high risk pregnancy, it does not mean the pregnancy is going to be 100% difficult and all those things. Please do not get scared that way. When we say a high risk pregnancy, it means there is a slightly an extra risk for this woman who needs a little more closer attention and treatment. It only means that. So this is not to scare you or threaten you. Please don't get worried. Some of the risk factors that we know already are like the age factor. If the woman is less than 18 years, she belongs to high risk. The complications for her are more. Their tendency to develop pregnancy induced hypertension is more, and to have a cesarean section, the chances are more for this woman. And also, no, she is not mentally mature like the other person. She is only 18, she is still a child. Okay. The other class is like more than 35. After 35 also, the complications during pregnancy and delivery are more. So this is one of the important risk factor. Then the other one is the weight of the person. If the person belongs to a BMI of less than 19, she is undernourished. This woman may not be able to put up with the difficulties of pregnancy easily, and her child also will be a little growth retarded. Again, if the woman has increased body weight, a BMI of more than 30, again the difficulties are more. Obesity per se can produce lot of problems. Then the height of the woman. If the woman is very short, about say 5 feet and 2 inches or less, her pelvis is also going to be small, and then the chances for cesarean section are more in this lady. If the woman has had repeated abortions before, again the risk is a little more than the person who has not had any abortions. If the woman has had a very bitter experience in the last pregnancy, like pregnancy had to be terminated because of increased BP, or the baby died in uterus before, or she had a difficult vaginal delivery, or she had a difficult cesarean section, wound infection, all these things again increases the risk. If the woman has had a previous cesarean section or any other surgery on the uterus, then again the risk is more. Apart from these factors, the conditions during the present pregnancy. Okay. At the onset of pregnancy, if she has had bleeding, then she belongs to high risk. If there are twins, it belongs to high risk. If the placenta is in the lower part of the uterus called placenta previa, then she belongs to high risk. As these things again can be found out in the initial months of pregnancy. As the pregnancy advances, if there is over distension of the uterus, if the baby is very big or if the baby is very small and the fluid around is less, they again see whether it is very big or very small, both are riskier. And if the presentation of the baby is abnormal, again the risk is more. If the person develops vaginal infection, or if the person develops other complications during pregnancy like BP or sugar, then the risk factor adds on. So whatever it is, as I said, please don't get worried, don't get scared. In these conditions, you need close monitoring, more frequent visits to the doctor, and a well planned delivery.